Today is the 20th anniversary of the first text message. It was sent in 1992. I don't know who sent it, but I'm hoping that you can talk a little bit about where you see text having gone and how it fits into your work with mostly mothers and children, or soon-to-be children.
Well, as you know, BabyCenter is part of the J&J family of companies, and we've always believed in the power of technology to really move our initiative forward, and especially in empowering women, new and expectant mothers in the world. And for us at BabyCenter, we deliver most of our information digitally, and we do this a lot online, a lot through mobile applications, but and giving the week-to-week advice, trusted advice and friendship for moms around the world. We actually serve 32 million unique mothers globally every month, and we communicate with them usually via these apps and online. But we realize that there's a lot of the community that is underserved that can't reach us through the online chains. So we have developed programs through SMS to be able to reach the underserved communities. Today, there are more mobile phones, flip phones, basic phone technology in the underserved world than there is access to water. Somewhat sad, but true. And so using that as a solution to reach moms has been something that J&J and BabyCenter, and now the program that we've created, Mama, alongside USAID, UN Foundation, and the mHealth Alliance with J&J and BabyCenter, has been to create these messages to be able to reach these moms on a weekly basis. And we believe that we are starting to change the world and empowering these women with information, vital health information, as well as the delight factor, so she becomes emotionally connected to her baby. And we can reach her in this way. So it's become a very great distribution tool to the underserved women.
So can you repeat again how many women that you serve per month?
With BabyCenter, we actually serve 32 million unique women per month.
Wow.
And that's globally. We have 22 websites around the world. With our Mama program that we have, our public and private partnership, we actually now have developed adaptable messages that can be delivered both in SMS format or in voice via audio IVR systems in order to reach a more underserved audience. And there we have now had those adaptable messages taken by 101 organizations around the world to date in 40 countries. And they are starting to adapt those and translate those so they'll be culturally correct for what they need, and in hopes to reach 20 million more unique moms over 2013.
And MAMA is an acronym for?
The Mobile Alliance for Maternal Action.
And it is action.
It is action. We are moving forward fast and doing very well. And have received a lot of great feedback from the NGOs we're working with, as well as the moms in the regions. South Africa and Bangladesh are two of the major programs that we have actually scaled as Mama. Bangladesh actually launches next week. South Africa launched a couple of months ago and just created a major deal with Vodafone, which is something that is necessary when you're talking about text-based messaging, because you need to make partnerships with the mobile operators, because it can get expensive for mom in these underserved countries to receive too many texts in a week. And so really trying to work hard with those mobile operators to make this a more sustainable and accessible program to those moms.
Is there a country that, an underserved country that you're trying to reach or that you would like to reach that's been kind of a tough area to crack?
Yes, India. We are actually doing a tremendous amount of research as the Mama team currently to be successful in India. There are many languages in India, many different customs in India, many people in India, and many births in India. So that is one we are tackling right now on the ground to figure out our best strategy as Mama in delivering these messages for SMS and audio.
Okay. I want to turn to UNICEF. Can you tell us a little bit about what role UNICEF plays? I think you have similar roles.
So UNICEF is on the ground in over 130 countries, and we work directly with governments to deliver programs for women and children. We work a lot in the health, maternal and child health area, and over the past 5 years or so, we've really looked at how we can start to integrate technology to support and strengthen some of these maternal and child health programs. Probably our biggest initiative in the space is something called Rapid SMS, which has the word SMS in its title and uses very simple text messages on very basic mobile phones to help the work of frontline health workers. So unlike BabyCenter and Mama, we don't focus on directly to the mother because normally UNICEF works in areas that are very, very remote, very underserved, and most mothers don't own mobile phones. So we work with frontline health workers, and we help them strengthen their work and provide better communication to a more centralized hospital, and then help them serve the women, pregnant women, and children in that area. We have scaled up in many countries. For example, in Nigeria, this past year, we've registered 70 million children. Which is essentially because Nigeria has a campaign to register all people in the country through birth registration, but they're also not registering just people who are born children up to age 18. This is to ensure that they can access essential services, whether that's health services or education services. We use SMS because it is ubiquitous. It may not be the best solution out there in terms of because you don't know if you've never confirmed if this SMS is actually delivered. There are many challenges with it, but it's ubiquitous and works on the most simple of mobile phones, which are also ubiquitous.
So I can see that you're really focused on SMS and you're making a big impact that way. But you mentioned technology, which I know SMS is, but are you using other healthcare technology in your work?
Well, we pair SMS with a more complex system which sits on the web, which visualizes some of the data or information that's coming in via SMS and helps program managers at a higher level where there is internet and electricity make decisions and be able to help them better manage their programs in real time. We are also involved in other areas, for example, looking at bringing rugged computing to certain areas, but I'd say our largest programs are very much focused in the mobile health space and specifically with SMS.
Okay. I'm going to ask each of you this. I'm curious about if you had a wish, for your programs, for each of your programs, what would it be? I mean, to move it forward. What? Maybe that needs a little thought.
Specifically with SMS, or
specifically for the program that you're. Yes. I'm sure you're trying to reach more.
Absolutely. In order to reach more moms, we need to continue to work very directly with the NGOs and the programs and folks like UNICEF of the world to get them the training. We're creating learning modules to be able to support the teams on the ground to develop the content well for their specific location and really working hard to create that delight factor, because so much of the success of an SMS program, while it's brief, is still that emotional connection, especially direct with moms, so that you would actually be able to convey not just the medical needs of what's happening as far as taking her meds, but to say, your baby can hear today. Why don't you sing to him? And don't forget your clinic visit. And so you really do invoke behavior change when you can emotionally connect. So continuing to work directly with the feet on the street and helping them understand that connection and then wrap it around the vital health information that we really want her to take action on to be able to save the lives of herself and her family.
Yeah.
And
It's
then
a little
hopefully-
text message and a big
yes,
outcome.
That's right.
Big
that's
impact.
Right, that's
Yeah.
right.
I'd say for me, I think I'd like for the use of technology, including SMS, to become second nature and part of the tool set for global health practitioners. Because I think while in this context there's so many people here, especially domestically, that really are trying to embrace technology, I think we still have a long way to go in the majority of the world. And it should be as second nature as using a pen
Yep.
or
Yes.
sending
Yes.
an email. So really getting people to become comfortable and to start to understand how technology can support them and actually help them deliver their programs better.
And do you see glimmers of that already?
Yes.
A little bit.
It's not as fast as I would like.
I understand.
Yes, exactly.
Okay. Thank you very much.
Great. Thank you.